to Bangladesh now, where the government and NGOs are struggling to ensure healthcare for Rohingya refugees. They've been relocated to Bhasan Char from the Cox's Bazar Rohingya camp. One challenge is bringing critically ill patients from the island to hospital on the mainland. WION's Bangladesh correspondent Lakbina Jasmine Soma reports.
It is the only specialized hospital with 20 beds on Bhasan Char Island for Rohingyas. This little baby has been hospitalized for several days with diarrhea. The mother said that her child has become much better after receiving treatment and medicine from the hospital.
My baby got better after being given oxygen and injections. The doctor have treated him well.
There are also opposite scenarios. Although admitted to the hospital with symptoms of kidney disease, this woman is not getting the necessary treatment.
I have a kidney problem. It hurts a lot here. I'm in pain.
While it has been possible to provide all modern facilities in Bhasan Char, ensuring healthcare for Rohingyas has become the most challenging. Out of about 70 NGOs working in Bhasan Char, only 6 are working on health. Crowds of patients were seen while visiting several hospitals, and most of them are children.
These people are waiting here to get basic health care. However, sometimes it is difficult for them to get advanced level or secondary level healthcare services.
GK, meaning Ganoshasthya Kendra, is working on the largest possible scale to ensure the well-being of Rohingyas with the funding from UNHCR. Last week, for the first time in almost a year, a young pediatrician joined the GK. While visiting the health centre, it was seen that the doctors were struggling to provide first aid. Especially patients who urgently need better treatment are at the highest risk. According to the clinic manager, critically ill patients are often at risk of death due to the distance from the mainland to Bhasan Char Island by sea and lack of adequate transportation.
First of challenge that maintaining the supply chain is a challenge. Required medicine and consumables, arrival and also storage and other things is a big challenge for the healthcare post or healthcare centers. Other thing is the referral system that you mentioned. If anyone needs secondary care support, they need to move from this island to mainland.
According to the Refugee Relief and Repatriation Commission, 255 children have been born in Bhasan Char in the last 1 year. In 1 year, 207 Rohingyas died in the camp. Most of the dead were children and the elderly. However, in the last few months, the death toll has dropped significantly. There is also a shortage of medicines. There are only 4 ambulances to take Rohingyas to the mainland for urgently needed advanced treatment. However, the government is planning to buy 2 more sea ambulances soon.
We are giving utmost importance to this issue because if we cannot develop health management, then we ourselves will be at risk. Not only Rohingyas but also various officials and employees are living on this island. So we have kept the 20-bed hospital here fully operational. We are building that hospital as a specialized hospital and ensuring the highest medical service there. If we could continue the medical camp system alongside this hospital, referrals from the island would be greatly reduced. Besides, we are keeping the health posts or PSCs of our NGOs functional.
Despite all these challenges, the success achieved in the health sector in the last year is quite impressive. Bhasan Char is the only place where not a single Rohingya has been infected with COVID-19 yet. The WION team visited several vaccination centres. Crowds of Rohingyas were seen coming to the vaccination centres to get inoculated. 2/3 of the total Rohingya living in Bhasan Char have already been vaccinated. The government is now conducting various campaigns to bring 100% Rohingyas under vaccination.
Access to healthcare is the basic human rights and Rohingyas are getting that. But in case of chronic disease, Rohingyas are at risk in Bhasan Char. So it is necessary to increase the capacity of the healthcare centers here. This is Lakmina Jasmine Shoma for WION at Bhasan Char in Noakhali.